Hi everybody, my name is Dr. Roman Magid. If you're new here, welcome. Otherwise, welcome back. It's been a few years since my last upload, and it's been really humbling to continue to see comments and likes on those old videos. In the last few years, I've had a very eventful time. I finished medical school, got married, had kids, and I'm about to complete my formal residency training in physical medicine and rehabilitation. Now on to the good stuff. What's wrong with Mr. Krabs? So, since he's smiling, let's assume we're meeting him in an outpatient clinic. He's smiling, he's walking, he looks generally happy, so he's probably not horribly sick, or he's not already in the hospital since he's not wearing a hospital gown. There's a few things that stand out just looking at him. We'll start with his eyes. They're bulging out of his head. Now there's a lot of things that could cause that, so we'll need a differential diagnosis. And the reason we need that is because until we interview him, examine him, maybe run some tests or get some images, we don't know for sure. So we should have a lot of things in mind, but with the most common things and the most dangerous things kind of at the top of that list. So one of the things that can cause your eyes to bulge like that is so the bulging of your eyes is called proptosis or exophthalmos, which is just medical use for eyes bulging out of your head. One of the things that can cause that is a thyroid disease issue. Something called Graves' disease can cause a autoimmune overactivity of your thyroid, and that actually builds up pressure behind the eyeball, pushing it out of your head. Other things that can cause that also build up pressure behind the eye, whether you have an abscess there, that would usually cause just one and not both, like in Mr. Krabs' case, or some kind of mass in the brain. Now that could be a tumor, or that could be something like a bleed, like a trauma. Any kind of pressure on the inside of the head can push your eyeballs out. Those are obviously really serious things, and if those are things that you're worried about, something like an MRI or at least a CT scan would definitely be helpful to get a sense of what's going on. Another thing is Mr. Krabs' bright red skin. Now this could be something simple like a sunburn, and we only see the parts of his body that are exposed to the sunlight anyway since he's wearing clothes. If it is a sunburn though, beyond just being uncomfortable, it does increase your risk for getting skin cancer, which can be life-threatening. So it's definitely a good idea to wear sunscreen, not just when it's hot outside, but really anytime it's sunny. But there's other things that can cause that, especially if we were to look under his shirt and see that skin looks super red too, even though maybe he's wearing his shirt all the time. Because that means maybe it's not a sunburn, maybe there's something else happening, like a medication reaction. So something that can happen is called red man syndrome, and there's a few antibiotics that can cause this, but the most famous one is Vancomycin. We use Vancomycin all the time, but sometimes, especially if it's given too quickly, it's an IV medicine that's infused into your blood, and if it's done too quickly, sometimes people can have this reaction. It's a histamine release. So the same thing that happens if you get bit of a mosquito. It makes you red, it makes you itchy. But since it's going directly into your blood, your whole body does this. And by whole body, I mean all of your skin. The treatment is easy. You stop the medication. And you should give Benadryl as well to reverse the histamine. There's other things that can cause skin rashes and red skin. Things like cellulitis, that's an infection of the skin, but that usually wouldn't be your whole body. There's something pretty scary called Stevens-Johnson syndrome. And if it's really severe, it could be your whole body. But you would also see lots of bullae, or something that looks like boils. And that can definitely be life-threatening. Things like poison ivy, lupus, all these things can cause red skin rashes, but I think they're less likely to cause a full body rash than the things we just talked about. And lastly, maybe this is more obvious than the other things, but he doesn't have hands, he has big claws. Now there is a possibility that he had a birth defect on both hands. And there's a kind of a controversial surgery called the Krukenberg operation that maybe was done for him. What would happen is, in childhood, you actually remove the hand completely, and you separate the radius and the ulna. These are the two long bones of the forearm. And that lets you use your own muscles to use those two bones, kind of like a claw. This was developed by a German surgeon, Hermann Krukenberg, in 1917. And it's really rarely done now. I've never seen it, I've only read about this procedure. Because it can have significant cosmetic and psychological effects. That being said, it is functional. You have full sensation of that skin, unlike a prosthetic where you only have indirect sensations of pressure. Or maybe he's just a talking crab. It's good to be back. Let me know what you think, what's on your differential. Like, comment, subscribe, and I'll see you at our next visit.